Health economics is the study of cost and utilization in the healthcare system. The cost of care is a major driver for what care our patients can receive and what care our patients can afford. With the costs of healthcare as high as they are, it not only impacts our patients, but impacts all of us with the cost borne throughout society. Thanks to discovery science, we have incredible interventions to help our patients live longer and higher quality lives. Unfortunately, many of those discoveries don't make their way to the bedside in a broad and equitable fashion. My research really focuses on trying to identify novel strategies for how we can implement high-quality care to all of our patients.
One of my currently funded projects from the National Cancer Institute is ASPIRE. It stands for Advancing Science and Practice in the Retail Environment. And this has leveraged public awareness about the problem of overconcentration of tobacco retailers in poor and ethnically minoritized neighborhoods, and really helped to foster some, and not only public awareness, but policymaking in some cities. The important thing about access to these substances is tobacco retailers concentrate in areas characterized by socioeconomic disadvantage and a higher proportion of racially, ethnically minoritized residents. So the health impacts of that much supply are evident in systematic review and meta-analysis that I've conducted for tobacco, where a preponderance of evidence suggests that a higher concentration of tobacco retailers is associated with some disease outcomes, especially regarding heart disease and tobacco-related disease.
We as cardiologists treat heart disease once it has happened, but the goal is always to prevent it from happening in the first place. I'm very interested in those early heart attacks that often will catch both patients and doctors by surprise. In cardiology and medicine, we've gotten better and better at preventing heart attacks that happen later in life. The ones that we often realize are a potential endpoint, people who are older and have many conditions like diabetes and hypertension and high blood pressure and high cholesterol. I'd really love for us to do a better job of preventing those heart attacks that happen earlier in life, often at a stage in life when people are just starting families, where they're actively working and doing many things, and maybe they don't realize they're at risk. And when the heart attack happens, what patients often tell me is, I didn't see this coming, what should I have done? My goal is that in 10 or 20 years from now, we'll have answers for those questions, and so that we can prevent those surprise events that have really devastated some families.